if someone out there is, doing this acronym FAST, and they realize maybe, or some of these, highlighted symptoms, they realize, okay, my loved one only has the headache and I'm not sure about the eyes. They don't have to have all of them for you to say, okay, let's get them to the hospital, right? That's important to note.
Yeah, it's important to know. I mean, but typically if you have a large vessel occlusion, you might have all of them. But if you don't, or something really looks odd, then of course it's better to call 911 and bring the patient to the hospital.
Because one can recognize from knowing their loved one or even a friend that, okay, something's just not right, and instinct kicks in.
No, that's a great question, because sometimes the stroke it starts gradually. So maybe it starts at the beginning like the face or the arm, and then all of a sudden progresses. And so as you call 911, you can see the patient getting worse and worse, then you take them to the hospital.
And it's critical to diagnose that stroke, doctor, because the treatments then can vary. Is that correct?
Well, no,
and we're going to talk more about treatments, by the way, later on. But I just wanted to touch upon it because depending on the type of stroke will depend on the treatment you receive, correct?
Sure, of course. There's different treatment for ischemic stroke, meaning blockage, like you mentioned before, of the artery, versus treatment of a bleed when an artery bursts and there's blood inside the brain. But for both of them, you need to be very fast. But in particular, if you block the blood flow to the brain, the thing you need to do, bring back that flow to the brain, and that's what we do nowadays very effectively. So as soon as you see the symptoms, take straight the patient to the hospital, because the outcome are all the studies show that the outcome are so much better if you take a patient straight to the angiography room, to a hospital where you can do this procedure and save their life.